Welcome. Today we're going to show you a great stretch exercise, particularly in the subscapularis. The subscapularis muscle is underneath the scapula. As you see right here, it's the largest, strongest muscle. It's the muscles primarily for internal rotation. People who have pronated shoulders, rounded shoulders, spending a lot of time looking down, rounded shoulders on a keyboard, texting, driving, slouching. That's the most common epidemic worldwide today. So therefore, this particular muscle becomes locked, it becomes fixated, it becomes adhesed. Adhesed means it becomes like glue, like myofascial changes that take place underneath it that prevent that mobility. Now understand, when this particular joint right here in the subscapularis, this joint has to move. And when I say joint, it's not a true joint, but this shoulder blade has to glide in order for the shoulder to move. So when this area becomes locked and becomes glued or sticky in there, it affects the shoulder mobility, causing significant pain in the shoulder, which can lead to chronic bursitis. It can lead to frozen shoulder, adhesive capsulitis. It can affect the complete range of motion of the shoulder unit. So this particular technique, as Aaron's going to perform, we're going to release three parts: the superior, the middle, and the inferior part. And as we release this, immediately he will feel a tremendous change. So if you're experiencing problems in the shoulder, you can not only look in the shoulder, you have to look the whole entire joint of the shoulder, which includes the scapula. Okay, first thing we're going to have him put his hand behind the back. Now, obviously, you would need someone to do this for you. You cannot do this exactly on yourself, but it's a very simple procedure. But you see, when he brings his arm behind his back, the shoulder blade actually comes out. So therefore, we now have room underneath to grab it, because we're going to pull it straight posterior. We're going to be pulling it straight back. Okay, let's go for the, you want to do middle first?
Yeah, I'm going to do middle first.
Okay. We're going to grab the middle area there as he sticks his fingers in there. The most important thing is we want his shoulder to relax. So just drop this shoulder. There you go. Just drop. There you go. So now he got his fingers under there. He's got the pull. He's going to hold that and just pull it straight out and towards him. And now you feel that muscle really stretching there, Dan?
Yeah.
Okay, good. So now we're going to hold that about 15 seconds or so. Just once we really pull it and stretch it, because once you have adhesions, which is scar tissue, once you release the adhesions, then you get that mobility again. Once you have that range of motion, you're good. You'll always have it. Now we go in inferior, and it's good to start medial because that's the easiest point to locate to be able to pull it. But once we stretch the medial, it'll be easier for you to get in the inferior. Same thing underneath, pull underneath the inferior part of the shoulder blade after about 15 seconds and release. The hardest part is going to be superior, because that is the closest to the shoulder. So if you cannot get full superior, I want you to at least get medial, which is the middle part, and the lower part. Aaron has a lot of expertise at this, but although if you notice when he gets superior, you're not going to be able to pull out as far because it's closer to the shoulder joint. So you'll notice it's not coming out as far, but once you get under there, you'll pull the best you can to release those tight fibers. Beautiful, excellent. You can have a seat. So the most important thing about this procedure, you must have that shoulder relaxed, because a lot of times when someone gets in that shoulder blade, even though you may not be thinking you're tightened up, you are tightened up. So really just let that shoulder fall, because the more you let that shoulder fall, the more those muscles are going to release. If you have questions, I'm sure many of you will. I'm sure many of you will have comments. Leave your comments below. I ask you to share this video with others. I ask you to subscribe if you haven't, so you can continue to receive the best of the self-help videos here on the internet. And most important, make it a great day. I'm Dr. Alan Mandell.